Hi, you guys. This is part of my expert series, and I'm so excited to have Dr. Linda Kim on today. A lot of people, they're concerned about how IVF is going to make them feel, what the lifelong complications could be from treatment. And for me, that is the mental health implications of if treatment doesn't work. Going through treatment and having it not work especially is extremely hard on our heart, on our mind, on our souls. And for me, the most important part of the fertility journey, believe it or not, is taking care of your mental health. So I invited Dr. Linda Kim on today. She's actually a very dear friend of mine. She was a medical student with me in Boston. She's a Harvard-trained psychiatrist. And so I'm super excited to have her on with me. I'm just going to find her here. I just taught her how to do Instagram. So I'm trying to see if she's here yet. And I don't see her quite yet, but she'll figure it out here in a second. So we're going to talk about her specialty as a psychiatrist. We're going to talk about, whether you should continue your antidepressants when you're going through fertility treatment. We'll talk about how to deal with a negative pregnancy test, all of those things here in a moment. Here she is. She's going to join us here in a second. She started a great company called Love Luck, LUVLUK.com. Hi, Linda. Thanks for joining me today. I really appreciate it.
Hi, Amy.
So as you know, mental health is also near and dear to my heart, and I know it's your life passion because this is what you do as a medical doctor. So tell us about what you do.
So I am an adult psychiatrist. I have seen thousands of patients over my 10 plus years in practice, dealing with depression, anxiety, PTSD, bipolar disorder, everything you can imagine. And through my work, I've decided to really focus on mental health issues near and dear to my heart for women, so women's mental health, and really starting to find a way to talk about, right, mental health issues for women specifically, especially with all their hormonal changes, PMS, menstrual cycles, menopause, pregnancy, everything you can imagine. So it is my life's passion. I love to talk about mental health, and I love to talk about hormones and PMS and fertility. So I'm excited to be here.
Thank you. Okay, I'm going to drill you with questions. First one, should a woman stop her antidepressants if she's starting fertility treatment?
That is a question for the woman and her individual doctor. But I will say, for the most part, I actually think, and everyone now has starting to jump on the bandwagon of saying the most important thing is that the woman should feel as emotionally well as possible. And if you feel the best on your antidepressant, then you should continue. Again, this is something that's a very individual decision depending on your own personal psychiatric history and what your beliefs are. So please talk to your doctor. But when I work with women, we figure out what's going to help you feel your best. And if that includes antidepressants, then we'll absolutely include it.
Love it. Okay, does stress cause infertility? Yes or no?
No, stress does not cause infertility. The things that cause infertility are all the things that they're going to go to you for, right? Their
Right.
age or anatomical issues, whatever, the Tushy method in terms of figuring this out. We know that stress can influence how you feel and how you manage, right, in terms of your emotional wellness during your infertility progress or your journey. That being said, we also know that the opposite happens though, right? Infertility does cause stress. Sometimes women say, and this has been shown in studies, is that sometimes the amount of stress that a woman goes through when dealing with infertility treatments can be as much as after having a heart attack or even cancer. So what
Right.
we want to do is we want to say your emotional health is a priority. We want you to feel as well as you can.
Right. I mean, I talk about fertility treatment as if it's a heart attack in your uterus, I mean, it's like one of the
Absolutely.
most painful things a woman can go through. And one of the hardest things that I have to do, I mean, I know this isn't about me at all, but obviously I care a lot about my patients and their well-being, is share negative outcomes or bad news with people. What kind of recommendations do you have around that as to how I can better support patients and what patients can do themselves?
That is such a tough one. I know because actually, my friends, my families, two of my sisters, so I'm one of three girls, went through infertility and they've had their own share of ups and downs, including negative outcomes, right? Or in terms of not getting their positive outcome. And the first thing I'd recommend is absolutely give yourself the self-compassion, give yourself the time to grieve. It's a grieving process, right? You're grieving that possibility of this positive outcome of getting pregnant, maybe in terms of, the finances, the money that you spend, even of the emotional bandwidth that you put into the process. Give yourself that time to grieve. The second thing too is what I like to call the emotional barometer. You actually want to know where you are, right? One day you might be feeling a little better and you're doing a little bit more. That doesn't mean that 2 days later you actually might go right back to that 100% grief state, but you won't know unless you start to check in with yourself and just start to identify how you're feeling. So even the act of like journaling or mood monitoring, whatever it may be, that actually is really helpful for you to just get more information about you and where you are. The third thing I'd really actually recommend is that you just don't want to get stuck in that feeling, right? So you've acknowledged it, you're grieving it, you're kind of keeping track of yourself. If you're starting to get stuck, that's the time when you say, hey, loved one, my partner, my friend, my wine buddy, whatever it is, I need a little bit of support right now. Reach out, just don't get stuck. Don't let those negative thoughts and that kind of like catastrophic thinking, overwhelm you and take up too much bandwidth. The next one I actually say is, along the lines of flexing your muscles, of just being really proactive about what steps you're going to take next, right?
Mm-hmm.
This is a journey. This is a process. You can be proactive about it. And that's what my whole goal is that so many women have told me that they felt like this was like a passive process. People are doing things to their body. They don't know what's going on. They're just like going back and forth. It doesn't have to be that way, right? You can be in control. You can be active. You can be empowered. And the way to do that, though, is to start visualizing and thinking about it and exactly what concrete steps you're going to take. So again, it's taking more of that proactive approach for your next steps.
Right. Oh, that's such great advice. And then how about during fertility treatment? What can a woman do actively to make sure that she stays mentally healthy, mentally well? And not just women, but men too.
I mean, it comes back to the basics, right? So it's interesting because I felt like a lot of women are told to do exactly that, right? Stay as emotionally well as you can, or just relax, or just take care of yourself. And the first thing that happens when I meet with a woman is she's like, they tell me to relax, but how do I do that, right? I'm so stressed out. And so actually what we do is we go back to the basics. Okay. So what does it look like? What are you eating? What's your patterns? What's your spiritual side? What are you doing in terms of, and things that we call self-care, right? We actually list it out and figure that out. Who's your team? Who's your posse, right? Who are the ones that are going to be your cheerleaders? And we all know that we have some ones, even though they say they're our friends, there are naysayers and our biggest critiques in the background, kind of like
The fertility trolls, the fertility
the
trolls.
fertility trolls, exactly. And so, but if you're proactive in knowing who that is, you can start to actually say, okay, that person during the next 6 weeks, I'm going to limit my interact. You can just, again, it's this idea of you can be the decision maker in this process. So we go back to the basics. You want to make sure that, sleep, eating, exercise, nutrition, spirituality, those type of things, right? And then there's some of these other things that I've learned along the way throughout my experience as a psychiatrist and a therapist. It's some of the things that we don't necessarily talk about in Western medicine, but it's the things like some of the supplements that can help, right? It's the things like the power of the mind. It's the things like using your heart rate variability, your vagus nerve, the abdominal breath, the imagery, the mantras, all those different types of things that we kind of put together. It's so interesting too, because I'm actually doing some executive coaching type of training programs. What boggles my mind is that we give these executive coaches all this very, very concrete advice in terms of how to be the best leader,
Right.
how to engage your team, how to motivate others. And we don't do that for women going through one of their most biggest challenges in their life. And I'm like, oh my God, why don't we help women with these like same set of tools?
Right.
Right. And so then that's why I was like, I felt compelled to say, okay, it's definitely Western medicine, it's psychiatry, it's do you have depression, do you have generalized anxiety disorder, what are we going to do about it? But it's also the holistic approach, it's also the sports psychology. You are an elite athlete going to the Olympics, right? Your Olympics of this journey. How do we set you up for success? And it's also that like you are the leader, right, of your own journey. How do we give you the tools to make this the best process that you can and for you to actually enjoy it? it doesn't have to be that much of a struggle. So
Right.
there's all these little pieces that I just, as you can tell, I just love talking about and love sharing.
Right, right. Well, I can tell. And I know my
Okay.
patients enjoy, they love working with you. And you
Great.
also are, you have some group sessions as well. Is that right?
You know what? Yes. I mean, it's something that I've been talking about with my patients, and I do it on a one-on-one way. And
Right.
I find myself repeating the same things over and over again. And I'm like, there has to be a better way, right? Instead of saying the same thing. And actually, I know too that women, they get so much from what they offer each other
Mhm.
in terms of the peer support, in terms of like, this happened to me, I want to be your cheerleader. And so I'm like, okay, again, I'm in this position of trying to put all the best of the world, like everything I can
Mhm.
together. And so I'm actually in the process of developing this curriculum for that, and it will be ready next month.
Awesome. Well, we're going to have you back to talk more about it. And I'll be
Great.
sure to add something in my newsletter so people can know about it. And for
Awesome.
those of you who want to learn more and sign up on her newsletter, go to loveluck.com, LUVLUK.com, and please follow her on Instagram. I just got her on Instagram Live for the first time today.
Thank you, Amy. You are like my PR media specialist because I got to tell you, even though my husband's like in this tech world, I am the
Yeah,
least tech savvy in the entire world. My kids, like, they die on the ground, rolling their eyes, laughing at
that's
me
so
because I
good.
just don't know how to do anything tech.
Well, it's so fun to see you. You guys, Linda and I know each other from, I don't know, 2000 and way
Way
long ago,
back,
like
way
2000,
back.
probably five, six, from when I was a resident in Boston and she was a medical student. So it's so fun for us to connect in this way. So Linda, thank you for all you do. I hope that people who are listening to this hear your message of hope that there's always a way to get
There's
help
always
with
a
your
way.
mental health issues during fertility treatment. So it's so important to be connected to other people and to find your fertility posse.
There you go. I like that. Yes.
Okay, cool. Well, thank you, Linda. Have a great
Thank you,
weekend.
Amy. Bye
Okay,
bye.
thanks
You
everyone.
too.
Bye-bye.